record.
Good afternoon, everyone. Thank you so much for joining us. This is Dr. Misty Paul, and I'm joined by my very good friend, Meg Tiffany at Basics. We're coming at you from Basics First Chiropractic. At least I am. Meg is sitting at her lovely home. And it's Wellness on Wednesday. So it's time for our WOW meetings, and we're going to explain to you in just a little bit what our topic will be, but we're going to have this the first Wednesday of every month, and it's always going to be recorded, but we'd love it if you can join us. And let me give you the Zoom ID so you will have it for the future. It will be that same Zoom ID each time, and that ID is 810-031-6762. We hope that you'll be able to grab your lunch and sit and listen to us. Thank you so much. Meg, I'll let you take it away.
All right, well, good afternoon, everyone. I hope you've got something to enjoy while you listen to us talk about the what, when, where, how, and why of neck pain, headaches, jaw pain, and vertigo today. That's our topic. And we are going to get started right here. So we have a series of topics that we're going to talk about, as Misty pointed out, on the first Wednesday of every month. And so we've already covered low back pain and low back pain with sciatica. Today is the neck pain with radiating arm pain, headaches, vertigo, and jaw. So those are all in blue, so that shows our focus. And then later on in the next coming months, we'll talk about upper extremity pain and lower extremity pain. So our head and neck. I just want to talk a little bit about head, and common symptoms include obviously headaches, which we've all probably experienced, jaw pain, vertigo, and dizziness. And then we want to talk about the cervical spine. If you saw our low back episode, we talked about all the different sections of the spine. So the cervical spine is the neck area, and common symptoms include pain in the neck, radiating down the arms, shoulder pain. Obviously, headaches can come from the neck, work up into the head, numbness or tingling in the arms or hands. Misty, would you like to add anything?
Yeah, I would. And the reason that we've, if you're wondering, boy, they're talking about neck pain, but also shoulder and tingling in the arms and hands, and also jaw pain. Well, there's a reason for that. The muscles in our neck connect to the very top part of our head and also to the jaw area. And underlying those muscles at the very, at the connection between the head and the neck area, the shoulder, those nerves that exit from that area, the upper part of the shoulder, they travel down our arms and hands. So we had talked about this with sciatica, and numbness and tingling in the arms and hands is very similar to sciatica. The origin of it is probably coming from your neck. So we're going to address the neck and trying to make your arms and hands feel better.
Okay, so head and neck pain, what is it and what causes it? So trauma from injury is a common cause for head and neck pain. Poor sitting posture, right? You're slumped down like this, really bad for your head and neck. Degenerative conditions like arthritis, degenerative disc disease, spinal stenosis, bone spurs. We've all heard these terms, and Misty can clarify them a bit more for us. Jaw pain, we've all heard about TMJ. Misty will talk a little more about that. Muscle tightness, when you get stressed and you start doing this. That's what I do. I know I do. I get stressed and my shoulders start going up. Not good for your head and neck. And vertebral misalignment. And Missy can talk a little bit about that. Something's not quite where it needs to be in your spinal column. And inflammation, the underlying problem across all of these is that nasty little bugger, inflammation. Misty?
So trauma, the most common trauma that we see from injury is car accidents. People have whiplash, and the consequences of whiplash can be long-standing. So getting good chiropractic care will really help with that. The other kinds of trauma that we very often see are people, are young athletes today that are involved in sports. And we also treat them too. But we like to be able to divide up the pain that comes in, or the injuries, into acute versus chronic. Depending on how long you've had the problem, gives us a good indication of how much muscle tightness, to tendon problems, to vertebral misalignments, and really scar tissue there will be in the area. But anytime we talk about pain, the reason is because there is inflammation there. So inflammation actually is the number one reason that we want to be able to work on you. We do great work with decreasing inflammation, and we're going to give you some tips on how you can work on it at home.
Okay, so let's focus on head pain and what it is and what causes it. So you can develop headaches, sinus headaches, tension headaches, migraines, which are a little more complex. There are lots of different types of migraines, and cluster headaches. And typically these are caused by common conditions like muscle spasms, right? If you're doing this all the time, your muscles are going to get tight and start spasming. Again, the poor posture business where you're doing this and you're just throwing everything out of alignment. Lifestyle can have a huge impact and be an underlying cause of a lot of these issues. For example, if you have allergies, that may trigger sinus issues and sinus headaches. Lack of sleep adds to stress, which can trigger headaches. And injuries certainly can be a main cause. So Misty, would you like to dive in a little more depth?
Yeah. Tension, sinus and tension headaches seem to just make sense. We know where we feel the pain, we know why we feel the congestion, and therefore the pressure that's causing the headaches. Cluster is, and many people are actually very familiar with migraines because they might have food allergies and they've just fallen off the wagon. They've eaten something that, a night of chocolate and red wine will do it for some people. But cluster might be an interesting one that you have not really heard of. Cluster is defined as, it can be very painful. All headaches can be, but these are very, very painful. They occur in one specific area. Most commonly with cluster, males will get it over females. And the number one most common reason for cluster is because of something going on with your trigeminal nerve that exits right at the jaw. So again, jaw is a great place to look at, and showing you ways that you can reduce the stress from clenching perhaps, or maybe sitting and putting too much pressure on that area is important.
Also for migraines, I know hormones, particularly in women, can be triggers for migraines as well. So if you're female and you tend to get migraines, you might want to take a look at hormones and getting hormones balanced out a little bit too. They can happen with your menstrual cycle. Some women focus there, find that that's the root cause of theirs as well. Okay, let's move on to neck pain specifically. So neck pain that's radiating to an arm, what is it and what causes it? So it radiates along nerves. And it can start back here and go right down the shoulder, all the way down. It can go all the way into your hands and fingers. It's typically, again, muscle spasms can be an underlying cause for them. A herniated disc, which Misty will define more clearly, and arthritis, like degenerative disc disease, spinal stenosis, and bone spurs. Misty?
So most commonly, it is the muscle spasms that are causing the pain, numbness, and tingling that's traveling down the arms. And we always start out with good conservative care, provide you with some good tips such as stretching, the different ways you can prevent the inflammation from getting worse at home. If people are not progressing, that would be a good time to determine, is this a herniated disc? At all times, the basics first, we're always making sure that we are doing our orthopedic testing to really answer that question. Is it a disc or is it muscle and joint? But the number one way to confirm that diagnosis is through imaging, and that would be an MRI. X-rays, of course, will show if there's degenerative joint disease, arthritis going on. And it can be a combination of all of those things. And even if it is, it doesn't mean that conservative care can't help. So we just have to be able to teach you all what to do for it.
So Misty, just to clarify, when you have radiating pain down your arms, the first thing you need to do is get the right diagnosis, and then you can figure out a care plan.
Yeah, it's part of what we do.
Yeah. Okay, thanks. All right, jaw pain, back to the jaw. So I'm going to let Misty talk in more detail about how the jawbone attaches to the skull and what that misalignment can result in. But other issues, so teeth, how you close your jaw and how your teeth meet can be an issue. Teeth grinding or clenching, injury to teeth. Again, the poor posture can impact your muscles in a way that your jaw isn't operating in a way that's comfortable for you. Stress can be a contributing factor, an underlying factor, as well as arthritis and gum chewing. Misty.
So, of course, during the pandemic, we have been sitting for longer periods of time than most of us used to. However, we have become a sit-down society, and it is the sitting for long periods of time and looking at technology that creates the head forwardness in our posture. So our ears are supposed to be over our shoulders, and as that head starts to lean forward, it not only puts a lot of pressure on the muscles and the nerves and the neck and the upper shoulder, but it actually puts a lot of pressure on our jaw. And so that's an easy way for the jaw to be misaligned. On top of that, if you are one of those stressed out people and you take it out on your teeth, or if you're clenching your teeth during the night, then that's a surefire way of aggravating the jaw as well. Commonly, another common reason is people get put into braces or they get Invisalign, and both of those conditions can all of a sudden alter the motion of your jaw. So quick little adjustments and little ways that we can show you how to relax those muscles in the jaw, and then you're off to the races with your braces and Invisalign.
So you said something interesting, Misty, with our head forward business and our ears should be over our shoulder. And what that made me think of is all the people, and most of us are guilty of it today, is on our cell phones. Our ears aren't over our shoulders. You see people walking along on the streets. We're a cell phone society. What's the impact of that? Is that a different kind of impact, or does that also lead to TMJ?
We talk a lot about text neck and the other effects that text neck has on our body, especially the jaw area. We're seeing more headaches than we have before, and we're teaching people with new technology comes new responsibility of taking longer breaks. Don't be on your cell phone for long periods of time. Even though the size of the cell phone has increased, it's still a small screen that you're looking at instead of a laptop. And so those are all things that we just need to be careful of.
Thank you. All right. So vertigo, this is something not a lot of people experience, but it's a term most people have heard. And I personally have had vertigo, and it's very disorienting. You do get this sense of whirling, a loss of balance. Maybe you're walking not in a straight line because you can't feel that. It can be an inner ear issue, but it can also have be caused by an issue with the vestibular nerve, and Misty will go into more detail on that. Common issues is this BPPV, which I'm going to let Misty talk about. It's basically a bang to the head. Infections can cause it in sinuses and allergies. Meniere's disease and also migraines can trigger vertigo. So, Misty?
We see a lot of this. It's something that we treat quite frequently. And in our area, most people have it commonly because of allergies. So they're congested, and it's affecting that whole balance issue because of that increased congestion. But it's, again, we'll talk about some essential oils that can help with that too.
Okay. All right. Managing head pain. So let's talk about some products, specifically doTERRA products, that you can use at home without having to use pharmaceuticals that have side effects. These are certified pure therapeutic grade. So they're basically a medical grade, very clean, very pure, and very effective and powerful on the human body and helping us manage our own health at home. So Past Tense is a wonderful oil. It's a blend oil that works beautifully with helping suppress some of the pain and manage some of the pain associated with headaches. Peppermint is also a fantastic oil to help manage headaches. Just be very careful when you're using Past Tense and peppermint. They both have peppermint in them, and that can be irritating to the eyes. So Past Tense I tend to use back here near my temples, very careful not to get to my eyes. You don't want to get those in your eyes. Copaiba is a wonderful, comes in both gel cap and the oil. It really helps calm the nerves and relax the nerves. So it's a wonderful oil, single oil to use. Frankincense, the king of oils. When in doubt, pull out frankincense. It will help. I have used frankincense in the past to help manage headaches, and it's been very effective. It's not an oil I would have chosen. Somebody else suggested it, and it worked beautifully. And then lavender, which we all know is a very calming, soothing. So if you're stressed out, lavender may be the right thing for you to select to help you calm down and feel better. And all of these can be used topically. Past Tense is not designed for internal use, and you can always breathe them in. Cup your hands, put a couple drops in your hands, cup them over your mouth and nose, and just inhale, and it can really help provide some great relief. So a little bit about Past Tense in more scientific terms, if you will. It is classified as an anti-inflammatory. So you remember, root cause of many of these issues is inflammation. So how do we reduce that inflammation to feel better? So it's made up of wintergreen, peppermint, basil, and frankincense, are all parts of what the anti-inflammatory properties are in Past Tense. It's also classified as an analgesic and anti-rheumatic, anti-spasmodic, a vasoconstrictor. It can be stimulating. It's an expectorant, so it can help get that congestion out of your sinuses. It'll help open them up and help them drain. Sedative to help you relax, like we talked about earlier with some of the lavender. Neurotonic to help calm those nerves, and steroidal. I'm going to go through these fairly quickly. So if you have questions, you can always post on the Soul Sense or the Basics First Facebook page or website, and we'll be happy to answer any questions you have about these.
And it's also good that it's recorded and you can go back to it at any time. And what you'll find over the next few slides is that these oils have both anti-inflammatory products. They have products in them to help decrease pain and decrease inflammation. And of course, help decrease the stress that the muscle is under, which is why we love using them topically so much.
Mm-hmm. Absolutely. So the antihistamine properties, Misty talked about allergies triggering migraines. Get that antihistamine with past tense, it can really support that. Relaxing, soothing, regenerative. The list goes on all of the fantastic properties that are contained in past tense. So let's go on to peppermint. So peppermint, when you take it internally, it helps with a healthy respiratory function. Again, you know, it'll help clear out your sinuses. It helps support breathing, and it also helps the digestive system. And you can see down below the primary properties. Again, it's anti-inflammatory, it's analgesic, which helps manage pain, antispasmodic, again, the reference to helping the muscles relax, warming, invigorating, etc.
I just
Okay.
want to say one thing about the peppermint. Peppermint will only help the digestive system if it's a muscle spasm that's occurring. In other regards, it could actually bother the digestive system. So always be careful with peppermint. It's not meant for all digestive issues, but I love it, especially to try topically.
Yeah. Okay. So copaiba, why are we so interested in copaiba? So if you take it internally, it's a great support for your immune system. And we just need immune support across the board these days, as everyone knows. It supports the cardiovascular system, the digestive system, and again, the nervous system. So it may be neuroprotective. We talked about that earlier. It can help soothe those feelings of anxiety. And it does not contain any of the psychoactive cannabinoids that CBD oils contain. This is not a CBD oil, but it does act on similar parts of the brain and the nerves that CBD works on without that other side effect.
That wonderful endocannabinoid system that we have, it's another part of our nervous system that we're starting to learn so much about. And of course, the CBD market has really blown up in the last few years. And these are products that are supposed to help the endocannabinoid. Well, here's a product that we have, copaiba. It does extremely well on the endocannabinoid system without giving you the psychoactive effects.
Yep. It's also anti-inflammatory, anti-arthritic, analgesic, and it's a very powerful antioxidant, and those are so key to good health. So frankincense supports about everything. Healthy cells, immunity, digestive function. Again, when in doubt, pull frank out. It combines beautifully with bergamot and lavender. And if you inhale or diffuse it, you can really create a very calming environment. It's an immunostimulant, so supporting the immune system. It's, again, anti-inflammatory, antidepressant, and is classified as being restorative. And then lavender. Lavender is very calming to the skin. If you take it internally, it can help with relaxation, and it also is great for supporting when you diffuse it, peaceful sleep. It's a natural antihistamine. It's relaxing, it's soothing, and antibacterial. So,
easy to see how if you are nice and relaxed, how your pain's going to get better too.
Yes, absolutely. And that's why it's so important and why we want to talk about it in relation to neck pain. So often questions we get are, how often, how much should I apply? Those kinds of questions. So use these as you need them. A rule of thumb with using CPTG essential oils, a little bit goes a long way. So a little bit more often is much more effective than one big dose, because your body just can't absorb that much and work with it. So it will just get rid of it. So a little bit more often is much more effective. Follow any kind of directions on the bottles, like with the supplements, like the Copaiba soft gels. Follow the directions for that on the bottle, and you'll find that it's very effective. So where do you apply? Well, we're talking about neck, temples, shoulders. That's today. So you'd want to apply to those areas, migraines in the head, crown of the head, base of the skull is a great place to apply oils.
If you're
And
having
again,
jaw pain, then right on the close to the back of the jaw, right underneath into the front of the ear a little bit is a
where,
great place.
so right where that little indentation is, just
Yeah, and
below
you can
that.
just put your fingers on where your jaw opens and closes.
So those are some great tips. Temples, apply it where it hurts. Take it internally as directed. And then how do I apply? So again, we just talked about applying it, and you can layer some of the oils together as well topically. You might want to put one and another on top of that. That can be great. Add some heat to help penetration. Diffuse these oils. They're great for creating wonderful smelling, relaxing environments. And then take the ones that are appropriate for internal consumption according to the directions. Please, please make sure that when you apply peppermint, that you wash your hands, because you may forget that you put it on and then your eye itches, and then that's not going to feel very good. Other doTERRA products that support pain management. So we're not going to go through these in detail, but Deep Blue is just a fabulous product. doTERRA just released a new Deep Blue product, which is a stick that's combined with Copaiba together. And you can just, I don't have mine here, I'm sorry, but you just roll it up, kind of like a solid deodorant stick, if you will. You can just roll it up, apply it where it hurts. You don't have to use your hands to rub it in. So it's great for athletes in the middle of a game or something. Aroma Touch, lemongrass, turmeric is a fantastic anti-inflammatory. It comes both in a dual chamber capsules and the oil. Wintergreen, Siberian fir, and again, frankincense is getting repeated here.
So one of the things that I want to point out is that we've really gone over a lot of essential oils that you can use individually, or you can blend a layer together and you put them on topically. But there's also products that you can actually ingest. And of course, we can sometimes take these oils internally, but what I'm talking about are capsules, such as the Deep Blue polyphenols that you're seeing on this page, or the turmeric. And these are great, great support to as an anti-inflammatory agent.
Yes. And how do you get doTERRA products? So you can get them at Basics First. You can talk to Dr. Paul. You can talk to me. I have my contact information here. And you can purchase through the following link. And if you enter the code that's here, this X3GE9YZJPT at the checkout, then that's another way that you can get these. Please do not purchase doTERRA products from Amazon. There are issues with people. Amazon is not an approved reseller of doTERRA products, and people have tried to make a profit selling the doTERRA products who aren't authorized to do so. And there have been some issues because the oils are not doTERRA oils that have been contained in some of the products that people have purchased through Amazon.
Or they're diluted.
Or they're diluted, yeah.
Yeah, so we want you to get the real deal.
Yep, we want the real thing in your system. So summary, using certified pure therapeutic grade or CPTG essential oils provides non-addictive, effective alternative to treating pain without pharmaceutical products that can have serious side effects. Again, this is how you can get them in the second bullet. And we are going to be continuing these WOW Wellness on Wednesday lunch and learn programs on the first Wednesday of every month. And we look forward to you joining us. Thank you so much for participating today. And do contact us if you have any questions.
Thank you so much, everyone. Hopefully you've learned some things. Hopefully we've wowed you, and hope you have a great rest of the day.
Bye-bye. Thanks.